Hi, everyone. Good morning. This is Joan Altman from the Exchange. Thanks to the hundreds of people who are tuning in to join us today for this webinar about our upcoming immigrant health coverage expansions. Thank you to all the community-based organizations that are on, who we've been working with and engaging with as we are approaching our November 1st launch. We would love to hear from you if you are on the call and you feel comfortable sharing your name and the organization you represent. If anyone who's externally joining us today would care to share their information, we'd love to know a little bit more about who is able to join. You can use the Q&A box, which is how we will be communicating throughout the webinar. So feel free to put your name and organization in there if you feel comfortable, and also feel free to enter any questions you have throughout the webinar. We will be answering as many questions as possible in real time. There are some instructions on screen that help you access the content today in multiple languages. So the instructions can be followed to turn on live captions and subtitles. And please let us know if there are any challenges to accessing those. And again, I'm seeing that we're over 200 now with numbers still climbing. So we'll pause for a moment to let people join and then continue. This webinar is being recorded and it will be available immediately following the webinar at the link that you used to access the webinar. We will also be making both the slides and the recording available on our website. So again, thanks again, climbing over 220. Caitlin, let's pause here for a minute, just give folks a chance to access the captions if they need to, and then we'll proceed. Good to see so many familiar names popping up. Thanks, everyone. I know it's a short week, so we appreciate you spending time with us. Okay, Caitlin, let's go ahead and move forward to the next slide. And we can go one more. So thanks to everyone who's introducing themselves by putting your name and organization in the Q&A box. We will do our best to keep up with Q&A as we go and allow time to pause and ask questions throughout. We have a host of people from the Exchange and from the Healthcare Authority and from our sister program and from our call center supporting us on today's webinar. We are working together quite extensively to make sure as we move toward November 1st, everyone who's sort of newly able to purchase coverage under these upcoming expansions understand the work we've been doing and how we want to be working with you all over the next couple of months to make sure as many people access these new coverage opportunities as possible. I'm Joan Altman. My pronouns are she, her. I direct government affairs and strategic partnerships at the Exchange. You are also likely to hear today at some point from Lynn McHale, who's our chief of staff, from Joanna Dombeck, who's our compliance officer, and from Becky Carroll, who is the deputy division director of Medicaid over at Healthcare Authority. Next slide, please. Here is our agenda. We have a busy hour, so we'll do our best to move through this. I will say, I will sort of spoiler alert, at the end of the webinar today, we will be asking, one, if participants found it valuable, and two, if there is interest in us doing a similar type of webinar as we approach November 1st, so closer to the launch, to review some of this and cover any additional details people may find of interest. So at the end of today, we'll be asking, we'll get as much done as we can today. And again, we can always happy to come back and provide additional information if that's of interest. I will focus briefly on some Exchange background just for our newer community-based organizations and participants today who may be less familiar with our work. The Exchange is still relatively new in the grand scheme of state agencies and health coverage entities in the state, so we'll cover that. We'll spend some time talking through these two upcoming coverage expansions. And the two key dates for everyone to take away from today are November 1st, 2023, which is when our first expansion launches, and then July 1st, 2024, which is when the second launches. And we'll be talking about how we're getting ready for November 1st, how things will work leading up to July 1st, and then the efforts we're going to be making sort of throughout these 2 implementation periods to reach as many people as possible. We also know, and I want to thank and acknowledge the community-based organizations who've worked with us for the past year. We've been doing listening sessions and landscape scans and interviews with community and sort of working together to further understand our new customers and people who are undocumented in the state of Washington who will be coming newly sort of accessing Health Plan Finder or accessing Health Plan Finder in a way they're able to directly get coverage for the first time. We want to acknowledge the main access challenges that have been expressed to us, notably around affordability, around data privacy, and around the need to sort of use trusted community messengers to help share information and do outreach, particularly addressing language barriers and the complexity of health insurance and health insurance terms. We'll speak a little bit about the efforts that we're making there. We welcome sort of your input as participants in this webinar. Community groups we may need to further engage with, areas we may need to be more active, really looking for your feedback here. And finally, we'll just preview some next steps and provide some resources that you can access after this webinar. Next slide, please. Okay, so again, I think we're over 300 attendees, so really appreciate people taking the time. I'm just going to spend a few minutes familiarizing everyone with the exchange. The next slide sort of shows you at a high level how we serve people in Washington. So the exchange operates Washington Health Plan Finder, which is our online integrated portal that serves both sort of the Medicaid program and the private commercial market, which we call qualified health plans. So over 2 million people are using Washington Health Plan Finder to access health coverage. We'll note a majority of those folks, nearly 2 million, are accessing a host of Washington Apple Health programs. Those programs include some that are available to people who are undocumented currently, like our CHIP program and some pregnancy postpartum programs, where there's sort of under federal law, people who are undocumented are unable to access coverages through qualified health plans. And there are certain segments of the undocumented population that are unable to access Medicaid coverage. And those are the 2 main areas of focus today. The next slide shows you our official Washington Health Plan Finder website. I will say there are some lookalike sites out there that we've been working with our friends at the Attorney General's office to address. WAHealthPlanFinder.org is the site that you'll want to be on. You'll see our official logo there, and you see the look and feel of the site in front of you. We also have a Spanish website, and so at the top of this page, you can see where you can click on Espanol, and then here, if you click on that button, is what the Spanish website looks like, and it's a duplicate to make the same information available on our English site on our Spanish site. We also, of possible interest for the tech-savvy set among us, we have a mobile app. The WA Plan Finder mobile app is a place where you can, from your phone, take a picture of a document and upload it quite easily. We have tens of thousands of people who've downloaded the app and are using that as a way that they upload documents. You can also do that. We have about half of our customers use computers and about half of them use our website through a tablet or a mobile device. So again, lots of good options if you are someone on the go and looking to sort of keep track of your coverage and or you need to upload a document, which several people in our newly eligible population will need to do. And we'll speak more to that in a minute. The next slide shows you our customer support center information. We have a Spokane Valley-based customer support center that has bilingual and multilingual customer service representatives that offer support in Korean, Mandarin, Russian, Spanish, and Vietnamese. We also have a language line, telephonic interpreter services that provide, I think we're up over 240 languages now that we provide interpretation support in. So you can see the hours. Typically, we're open from 7:30 to 5:30 Pacific Coast time. We do extend those hours till after 5 p.m. during open enrollment, which is November 1 to January 15th. We have both kind of call center representatives, and we also have chat capability. So for people who need to be chatting and also multitasking, that's an option as well. The next slide shows you what will become a very important resource for us, particularly during these launches, which is our statewide certified assister network. We have a sort of extensive network across the state of people who've been trained to help people enroll and understand their health insurance options. You can see on the right is the map of the lead organization service areas. So we have multiple navigator lead organizations who cover different areas of the state, and our lead navigator organizations subcontract with over 100 community-based organizations who work with, who you can see there, nearly 800 navigators and certification counselors. So again, our navigator network, our broker community, our tribal assisters, well suited to help reach out and share information and support community-based organizations and impacted clients. We're looking to constantly grow this network and bring additional organizations into our assister network to make sure that we have assisters available in every community we need to. And the next slide, I believe, has additional information about how to connect with or if you're interested in learning more about how to join your local navigator network, we're happy to provide more information about that. So again, the top link on this slide will take you to the map that shows you the enrollment centers and the lead navigator organizations in your area. Enrollment centers are staffed either by brokers, a combination of brokers and navigators, or navigators. So again, we have Kelly Aaron, who is on the call and is our navigator support manager. She can help connect you to these local resources in your area if you are a group that is interested in that, and or talk you through next steps if you're interested in joining and becoming part of our certified assister network. The training happens in the fall. So it's well timed for groups that may be on the call who are interested in learning either how a navigator could come support and talk to your organization, and or how you could join our network as well. Finally, the last piece before we'll ask if there are any questions about the exchange and what we do and who we serve. The exchange has had a sort of longstanding commitment to equity. We have a bipartisan board who's nominated by the legislature and appointed by the governor, who has taken this work seriously. And these two expansions I'm about to talk about are very aligned with our core mission to sort of increase access to affordable health care. This updated equity statement that was sort of adopted unanimously by our board sort of speaks to some of how we see this work connecting to our goal that everybody have full and equal access to the opportunity, power, and resources to achieve their full potential. I'll pause there on the next slide to check in to see if there are any, for the 350 folks on the call and for our staff and support, to pause there to encourage anyone who has a question about the exchange and what we do and who we serve to enter it into that Q&A box. And I'll pause to see Caitlin and others if there are any questions or clarifying information I should share at this point.
We do not have any questions from the audience on this section.
Great. If anybody thinks of a question, do not hesitate to ask. And otherwise, we will roll forward. You've survived part one, and we are on to part two. This is where we'll talk specifically about these two expansions that I mentioned. The first is coming November 1st, so right around the corner. What we're gearing up for now will be sort of newly provide access to people who are undocumented to qualified health and dental plans for the first time through the exchange. These are folks who are over income for Medicaid or otherwise don't qualify for a Medicaid program. Then we'll be speaking to the Apple Health expansion for adults that's happening July 1, 2024. This will expand the coverage options that are currently available under the Washington Apple Health umbrella of programs to allow even more people to access sort of free coverage through those programs, which we're very excited about. The next slide sort of shows you in a graphic way what I just mentioned. Again, driving to some two main dates, both access through Washington Health Plan Finder, the first coming November 1st and the second coming July 1st. So what is it that we're sort of expanding and why? Since we launched the exchange in 2013, we have had tens of thousands of individuals, 50, 60, 70,000, who are undocumented, access Health Plan Finder. So it's a system that there are communities of people who are undocumented are familiar with and are using. People who are undocumented can apply for health coverage on behalf of other members of their family who are citizens or are lawfully present. But there are some barriers to the coverage they themselves have been able to get because of restrictions that were included in the Federal Affordable Care Act. So you can see there's sort of two main programs that are the focus of the expansions on the top of this chart here. Currently, people who are undocumented have been unable to access qualified health plans and qualified dental plans through the exchange. That includes available federal financial assistance like advanced premium tax credits and cost sharing reduction subsidies. People who are undocumented have also been unable to access the Washington Apple Health Program for adults. And again, there are programs like the Apple Health for Pregnant Women and Apple Health for Kids, and the Emergency Medical Program that are available to people today, regardless of status, and are being accessed through Health Plan Finder. But we do have some restrictions on, federally funded programs and federal financial assistance that exist today that we've been doing our best to address. I'll pause here to also note that, when you come to Health Plan Finder, you are asked, are you a citizen or U.S. national, and are you lawfully present? Because of these federal restrictions, we're required to ask you if you fall into one of those categories so we can screen you for the right program. That's we're working on adding, continuing to improve our on-screen language that explains to people why we ask these questions and what they mean. So under the Affordable Care Act, you need to be lawfully present to access a qualified health plan and qualified dental plan. And that includes, people who are U.S. citizens, U.S. nationally, or federally, or have a federally recognized immigration status. I will note, and we get questions on this quite often, that DACA recipients, people who are in the Deferred Action for Childhood Arrivals program, so colloquially DACA, are not currently considered lawfully present under the Affordable Care Act. When people who are DACA recipients under the Affordable Care Act are not currently considered lawfully present, when asked if they are lawfully present, they would need to answer no. I will note that there is a pending federal regulation that would change that and would make DACA recipients newly eligible and categorized as lawfully present under the Affordable Care Act. So we are watching that, and we will let you know as we move closer to the launch if we see changes there federally, and if so, when they're going into effect. The next slide speaks in some depth to the qualified health and dental plan expansion and how it is that we're able to do it here in Washington. So the legislature sort of directed us to apply for what's called a Section 1332 waiver. It allows you to waive certain sections of the Affordable Care Act. It sort of gives states flexibility to adapt the Affordable Care Act in a way that, as long as you're continuing to offer affordable coverage and make sure you're protecting access or increasing access, that you can try things at the state level that they did not enact at the federal level. So we were directed to and applied for a waiver to actually waive this lawfully present requirement for purposes of getting a qualified health and dental plan. We sort of shared information showing that it would improve access in the state and would not impact affordability. Health industry partners here in the state agreed with us. You all did some great advocacy to get this passed at the federal level, and we were approved for that waiver effective for 2024, which is how we're able to bring this to you. The next slide shows you kind of how the qualified health plan and qualified dental expansion that is starting November 1st will cascade. sort of no pun intended, but we'll down. So first, starting November 1, everyone will be able to shop for coverage through Health Plan Finder, regardless of your immigration status. That's the most important high-level takeaway. What that means and what that newly enables people to do, we have 12 carriers, health insurance carriers on the exchange. They offer a lot of different types of products. Among them are Cascade Care plans. Cascade Care plans are state designed plans that have lower deductibles and typically have lower premium price points. If you purchase a silver or gold Cascade Care plan, you can receive additional state subsidies, which are called Cascade Care savings. They're directed toward people who make up to 250% of the federal poverty level. We'll talk about what that means in a moment. So essentially, under the federal waiver, we could not waive the provision. We're not allowed, frankly. We would have tried otherwise. There are still restrictions on people who are undocumented receiving federal funding. So people who are undocumented will be able to access qualified health and dental plans, will not be able to access some of the federal subsidies that help make those plans more affordable. But the state has our own premium subsidy program that the legislature enacted for people up to 250 that everyone's eligible for, regardless of your immigration status. And that is what is going to help with affordability of these plans, and will help to a great extent. We know won't fully cover premiums like the Apple Health Expansion Program will. I'm going to pause on the next slide to see if there are any questions, Caitlin and others, I should address before sort of stepping through the rest of this section, and we'll provide an opportunity for people to ask questions as we move ahead as well with this information. Just want to acknowledge that we've covered a lot of ground here about how these pieces fit together. We'll pause and see if there are any new questions or, Caitlin, areas that you, Mary, Joanna, think I should revisit.
Yeah, so we have a follow-up question around will DACA or Dreamers be able to purchase a QHP now with this expansion?
Yeah, that's a great question. This DACA overlap is always complicated because of how the Affordable Care Act defines people who are lawfully present. So the two expansions that are coming up are for people who are undocumented, which DACA recipients. I'll start to answer this. Start again. Very good question, and others feel free to help. The DACA recipients can come in, but hopefully will be considered lawfully present under the pending federal regulation that will enable them to access federal subsidies that further lower the cost. So under the waivers, people who are not lawfully present, including DACA recipients, can come in and purchase health care and access Cascade Care subsidies. So yes, DACA recipients will be able to come in and purchase health care. If the federal law regulation that's currently pending is finalized as has been proposed, someone who is a DACA recipient will be able to come in, say, yes, I am lawfully present, and access coverage with the additional federal subsidies with or without this 1332 waiver. I'll pause there and see, Caitlin, Joanna, Wynn, if there's anything else that should be said to help clarify that. I really appreciate the question.
Yep, just one follow-up around those folks may not qualify for advanced premium tax credits, but they may be able to qualify for Cascade Care savings. Is that correct?
That's correct under current law. And if the federally proposed regulation that's out there in the ether gets finalized and approved, then those folks would be able to access tax credits, but we're waiting to see if that passes at the federal level or not. Another group that we get questions about quite frequently are people in the 5-year bar. These are people who need to be meet sort of a 5-year wait period before they are able to access Washington Apple Health fully subsidized programs. People who are in the 5-year bar, which is sort of a discrete sort of technical category, are able today to come in. These are lawfully present customers. So they would answer, you know, are you a citizen? No. Are you lawfully present? Yes. If you were in the 5-year bar, you're unable to access the Washington Apple Health programs right away, but you are able to access qualified health plans and qualified dental plans today, and you are able to access both federal and state subsidies. So that's another group that we receive questions about often alongside the DACA recipients. So wanted to make sure to address that as well.
Thanks, Joan. We did receive a question on folks under the 5-year bar, so appreciate you covering that. I think we can move forward at this point.
Great. Thanks so much. So for the additional 100 folks who've joined in the last 30 minutes, thank you for joining. We welcome your questions. We're stepping through a bit of the exchange background and some background for the upcoming expansions, one on November 1st and one on July 1st, 2024. We're stepping through what that will look like in the Health Plan Finder system, and then we'll step through some of the access barriers that we're hoping to address and to hopefully get all of your help addressing and spreading the word. So starting November 1st, anyone can come in and get a qualified health plan and qualified dental plan, regardless of their immigration status. That includes accessing the state's new Cascade Care plans that sort of offer higher quality and standardized benefits with lower premiums and typically lower cost sharing. Everyone, regardless of immigration status, who's up to 250% of the federal poverty level, will be able to access Cascade Care savings. You have to get a silver or gold Cascade Care plans to get those savings, but you do not need to be a citizen or lawfully present to get them, which distinguishes sort of this program from federal subsidies. So that's how it works together. The next slide shows you a bit about what Cascade Care plans are. If folks have questions on this, I encourage you to put them in the Q&A box. We have a lot of information on Cascade Care. They're new plans that we launched in 2021 that have sort of grown in popularity to the point of where majority of our customers are now in these plans. We are both proud and excited about them. That all the carriers in our marketplace offer Cascade Care plans. Typically in a Cascade Care plan, you're paying less when you go to the doctor. You have things like regular medical checkups and mental health visits covered before you have to pay any type of deductible. And the Cascade Care plans, again, are how you access and get Cascade Care savings, which is the additional savings. The next slide shows you what 250% of the federal poverty level looks like. So again, these are federal standards. If you are a household of one and you make under $34,000 a year, these income limits change slightly from year to year. But you would be eligible for this program. If you are a family of 4 making under $70,000 a year, you could qualify for this program. So Cascade Care savings that Washington Health Plan Finder, when you come to our system and you enter the information we need to determine your eligibility, we screen you for all the available Washington Apple Health programs. We screen you for any federal financial assistance you may be eligible for, and we screen you for any state level assistance you might be eligible for. And we tell you right then in real time, you know, here's what your premium would be, but with these additional savings, either your care is free through Washington Apple Health, or you have a premium remaining, and here's what that premium is. In a Cascade Care plan, you know, you are most often, if you qualify for federal subsidies and state subsidies, able to find a plan for under $10 a month. And with this, because there's people who are undocumented remain ineligible for federal subsidies, it won't be under $20, but we're doing our best in working with the legislature and others to maximize the state subsidy amount that you would be able to use to lower your premium. So the next slide shows you a little bit how this would work. We're using sort of the a lowest cost Cascade Care Silver plan in King County, for example, in 2024 is going to be around $400. Rates are still being finalized for 2024, so these are all sort of illustrative at this point, but we'll have more specific information soon. So if you're a 40-year-old in King County, you're making less than 250% of the federal poverty level, you are continue to be ineligible for federal subsidies, but you would get the full state subsidy. The state subsidy amount that we used recently in our public comment period to solicit feedback from you all was $215. We're continuing to look and finalize that amount, but as an illustrative example here, if your premium's $422 and you're eligible for Cascade Care Savings, you get $215 off your premium. So you're saving about 50% on your monthly premium cost, and you're looking at a cost that's closer to $200. $200 is noticeably different than under $10. It's noticeably different than the free coverage that's offered through Washington Apple Health, but we do think it's a good start in trying to make these programs more accessible and more affordable to folks. I'll pause there and see if there are any questions on Cascade Care and Cascade Care Savings, and then we'll turn to the Washington Apple Health expansion, where I'll invite my colleague Becky to add any additional information that she may want to share with you all 400 plus of you. Caitlin and others, anything else that I should clarify before we move to Washington Apple Health?
We are just going through the questions here in the Q&A. I believe we have quite a few questions that are around identity proofing and income verification, which I will hold until we get to that portion of the webinar.
Great.
I think we are ready to move forward.
Thanks, everyone. Really appreciate the questions and the engagement on this. Okay, so that information is really focused on the program that's launching November 1st, 2023. So around the corner from us, a couple months away. When open enrollment starts, everyone will be able to come to Health Plan Finder and sort of newly access qualified health and dental plans, regardless of immigration status. Following open enrollment, which is from November 1st to January 15th, there will be a subsequent launch and expansion of a new Apple Health program. And the next slide, Caitlin, shows you a bit about that program. So starting July 1st, the legislature has sort of funded the Healthcare Authority to create a new program for adults that expands coverage. So it's starting July 1st, 2024. The premiums and cost sharing under Washington Apple Health are $0. And as long as there's funding for the program, enrollment in that program will be open. Enrollment will be capped as needed based on the current funding level that's been provided by the legislature. The next slide shows you a bit more about who's eligible for this new Apple Health expansion program. So it's for people who are age 19 or older. And again, it's for people earning under 138% of the federal poverty level, which is about $20,000 for a single person and about $40,000 for a family of 4. So again, starting July 1st, 2024, when you come to Washington Health Plan Finder, you will be screened for all of the Apple Health programs that you are currently available for based on your immigration status. And then you'll be newly screened for this new free program for people up to 138%. And we've included the website there with additional information. Much more information on this program will be coming as we approach the launch. And Becky's on and can help answer questions if people have them as we move forward. We do have a few questions we get quite often that we wanted to address and share with you before we sort of pause and take additional questions and provide additional comment. The next slide covers the first question we get often, which is, what if there are members in my household who qualify for different programs? So that's one slide ahead, Caitlin. And currently there are individuals who are eligible for the Apple Health expansion, who are already using Health Plan Finder and are already have members in their household who are eligible for various programs like our pregnancy coverage or our kids programs. So about 40% of our households in Health Plan Finder today have members who qualify for different Apple Health programs, or maybe they have kids who qualify for the kids program, and adults who qualify for the private qualified health plan and qualified dental plan coverage. So it's a common scenario. Nothing about that is changing with the expansions. We're going to continue to determine eligibility for each household member based on eligibility factors like their immigration status. And again, we'll have much more information on the new Apple Health program will be forthcoming for folks who want to understand at a more detailed level how these existing Apple Health programs all are going to interact with each other. The next question we get quite often is, you have these two staggered start dates. So the next slide takes you there, where we're going to have this qualified health plan and qualified dental program expansion that launches November 1st. And then we're going to have this Apple Health expansion that launches July 1st. And how will these two programs work together? The Exchange and Healthcare Authority, Becky and I are in hours of meetings every week talking about this exact topic. So we wanted to make sure to acknowledge that we're coordinating very closely. And because we have Washington Health Plan Finder, which is serving both populations, we're very well positioned to move people who, so if you are someone who signs up November 1st, and you are paying $200 a month for your qualified health plan and dental plan coverage, and you are someone who is under 138% of the federal poverty level, on July 1, you will become eligible for the new Apple Health expansion. So we will be working with anyone who has come in and purchased a qualified health plan who is newly eligible for free coverage, to move them over and make sure they are aware of and understanding the differences between the programs and how they can access free care. So there will be sort of clear instructions and outreach materials that we'll be working on together, and we'll be doing everything we can to sort of streamline that process for people. The next slide is just a pause for questions. So I'll sort of see if there's any other points of emphasis staff on the call would like to make, or if there are any other questions, Caitlin, that we should dive into.
Yes, we do have a question. Can you talk about special enrollment if people miss open enrollment?
Yes, I would. Nothing would make me happier. No, that's an excellent question. So typically every year open enrollment is from November 1st to January 15th. For people who miss that window, there are opportunities to enroll called special enrollment periods that are usually based on your life circumstances. We are in the middle of the Medicaid unwinding. A perfect example, if someone churns off of Medicaid or an Apple Health program mid-year, they have an opportunity to sign up for a qualified health plan or qualified dental plan is one example. Enrollment for Washington Apple Health programs is year-round. So if you are someone who newly qualifies for this Apple Health expansion and the program still has openings and is available based on the appropriated funding level, then you are able to come to Health Plan Finder and see if you are eligible for Washington Apple Health programs at any time. So Medicaid programs can be accessed at any time. Qualified health and dental plans can be accessed mostly from November 1st to January 15th. And then following January 15th, if you are someone who would apply for Cascade Care Savings, if you're someone who's up to 250% of the federal poverty level, you have an ongoing opportunity to enroll. There are also opportunities for people who newly move to the county, like newly come to the country, newly move to the county, like move their place of residence. If you have a baby or there's a change in your household circumstances, you also typically are able to come in and find a plan that works for you. And I can ask Caitlin, we do have more information on special enrollment periods that's available on our website, and let's make sure we announce that for participants as well.
Sure thing. I will make that announcement.
Okay.
We are getting quite a few questions, so I am just scanning through them to see if they are based on the content we just covered, or we might cover them in another section.
Thanks, Caitlin. Okay, we'll sort of step through the next section and then come back and we'll make sure we allow some time at the end to circle around to any questions that we've received that we need to come back to. We'll also be capturing and recording these questions, and to the extent that things go unanswered, we'll do our best to follow up. Okay, you've survived section 2. We're on to section 3. We've been doing a lot of work to further understand impacted communities and who and how to most effectively reach people who are going to be newly eligible under these expansions. Again, just want to thank and acknowledge the multiple community-based organizations on the call and otherwise who have been helping us do that. We know a little bit from data that our colleagues over at the governor's office have made recently available. What the landscape of uninsured, undocumented people is in Washington. The next slide shows you the most recent information that's available from a report that OFM published just last month in August of 2023. So this really shows you kind of the persistent disparity that exists between being someone who's undocumented and having it be an incredibly strong predictor of being uninsured. Some of that we know are current federal barriers and legal barriers, and some are significant barriers around, are not legal and center mostly around affordability and government mistrust and the complexity and length of the application. And we'll speak more about each of those in a moment. So people who are undocumented have the highest uninsured rate in the state. In 2021, that was the estimated uninsurance rate was over 30%, close to 35% among people who are undocumented. And you can see here that's 5 times higher than the rate of around 5% that the U.S. born citizen and naturalized citizens, that uninsured rate. So this disparity of 35% to 5% is real and something that we're hoping the expansions help address. The next slide sort of we'll read through in a vertical top to bottom way just to keep it interesting for everybody. So on the left, recent estimates are that there are about 400,000, 410,000 people who are uninsured in Washington, and about 25%, so right around 100,000 of them, are people who are undocumented. Now, there are obviously higher populations. There's a diverse uninsured, undocumented communities across the state. We are interested from a geographic perspective as we're thinking through our outreach campaign and the diversity audiences we need to reach, where we need to be focused and really leaning in. There are 7 counties in our state, King, Chelan, Douglas, Franklin, Yakima, Grant, and Adams, most notably, who have an uninsured rate among people who are undocumented that reaches as high as 64% in Adams, 49% in Grant. You can see here the dark colored counties are where the uninsured rate is well above that 25% that we see across the state. And again, we know that census data is limited, which is what OFM uses to run these reports. So if anything, this is a conservative estimate of the numbers that we may see. On the right, you'll see how the breakdown of the uninsured, undocumented population in Washington, what the federal poverty level distribution is. This is relevant because, again, the new Washington Apple Health expansion is for people who are 0 to 138%. So you can see that that's a significant portion, around 35,000 of the undocumented uninsured population in the state. And then people who are up to 250% are going to be eligible for Cascade Care savings. So again, if you're looking here, that's another 30,000 plus people. So if you're looking at the uninsured, undocumented population in Washington state, there's a third who we think may be eligible for the Washington Apple Health expansion, and there's another third who we think are eligible for state subsidies through the qualified health and qualified dental plan expansions. There's a significant opportunity here to reach people who have been previously unable to access coverage in Washington that we're really excited about. To learn more about sort of how we can most effectively reach people, we've been sort of engaging with impacted community members and local organizations over the past year. Sort of been a multifaceted effort. There's been some listening sessions, some landscape scans, and some interview focus groups. The next slide sort of speaks to that at a high level, and the following slide is where I'd want to focus. That's the timeline of where this work has mainly taken place. Again, just want to thank our lead organizations, our lead navigator organizations in particular, who helped us organize some listening sessions very early on with close to 200 community members from various communities to help us sort of frame our thinking around how to approach some of this work. The Immigrant and Refugee Health Alliance, in partnership with Community Health Network of Washington and the Latino Community Fund, in partnership with Northwest Health Law Advocates, did some extensive work with landscape scans, looking across the state to help us understand kind of the current awareness of health coverage options among varied immigrant communities across the state. We also specifically asked about the current level of awareness and trust in the exchange and our partners, which we'll speak more about. And we talked about where and how information could be accessed and could be the most impactful. So, the next slide sort of speaks to some of what those learnings were. I think we heard loud and clear that our outreach and enrollment support has to be culturally responsive and that it's critical to work with trusted community-based partners. We also know that cost, closely followed by privacy, is a top barrier to accessing care. So, it's much less likely that the people who participated in the listening sessions and the more recent interviews, we had 13 sort of community-based organizations representing communities that we wanted to sort of speak to further after the landscape scans, sort of confirmed that people are much less likely to visit Health Plan Finder on their own, which is where we're really leaning into our Certified Assister Network and dedicating some additional funding and resources to them to help support these expansion efforts. We also heard loud and clear and know we have significant work to do around helping people understand health insurance and the value proposition of health insurance and how to use it. We know we can't just make this information available. We also need to sort of take into consideration how and where people are accessing it to get the word out, and obviously need to make sure that there's enrollment assistance and materials that's readily available in the languages spoken by the communities that are going to be the most impacted. So continuing to lean in and reach out there. We'll speak to each of these in detail. I will say, in the spirit of completely overwhelming Caitlin and others who are monitoring our Q's and A's, we want to hear from you. There are almost 450 of you on this call. We want to hear what the barriers are that are facing the people in your communities and in the communities that you serve. Affordability, mistrust of government and government websites, and health literacy and language access were the most predominant that we've heard across the work that we've done over the past year. If there are specific languages or specific communities that you want us to reach that we need to be reaching, if there are barriers that are not reflected by these categories, we want to hear from you. So to the extent that you are willing and able to enter, to put that information in the Q&A, we would welcome it. We're working on our outreach campaign now in partnership with others that you'll hear about a little bit later on. We want to know where we should be and who we should be reaching. We want to know if those communities that have the high uninsured, undocumented rates are the right areas to be focusing. So welcome your thoughts and advice there. In terms of each of these three barriers, we'll sort of step through, but the area we're going to focus on most is mistrust of government and government websites. We've received lots of questions and requests to take a deeper dive, so we'll spend a lot of focus there. We'll also preview some of the outreach and educational materials that we put together sort of in partnership with some of the community-based groups and assisters we've been working with. So you'll get a sneak preview there, and then we'll be disseminating that information broadly this month, and are hoping for your help sharing it and making sure people who need it get it. So first, affordability. I've touched on this already. It's worth saying again. Cost is the primary reason people are not accessing care, and we know that. Caitlin, it may need to click through a little bit. Feel free to just bring them all up. Yep, thanks. So we know cost is the primary barrier. We know that even with Cascade Care savings, it will remain a barrier for people who newly qualify for the qualified health plan and qualified dental plan expansion. We know under Washington Apple Health, having zero premiums and zero cost sharing is critical for people up to 138 being able to access care. It's also critical for people beyond 138 who are making just above minimum wage, who are sort of over income for Medicaid. So doing what we can with our Cascade Care savings tools and others, we know that people who are undocumented will continue to pay more for their coverage than people who receive federal tax credits, and just continuing to have that dialogue with the legislature and others about remaining affordability barriers, both for premiums and for cost sharing. Recognizing that Cascade Care plans do try to minimize cost sharing as much as possible and make as many services as possible available before the deductible and before you have to pay big out-of-pocket expenses. Moving on to sort of starting our privacy and government as trust conversation, I think sort of preaching to the choir of folks on this call, there's a history of government and public health and healthcare programs and policies that have harmed immigrant communities. People who are undocumented often do not feel safe sharing personal information. They have a fear of interacting with government entities. This is a theme that we've heard in almost every type of listening session we've done. It's a theme that we heard and have seen in community-based surveys over the past several years. It was a theme and something we heard when we were in the process of applying for our 1332 waiver, and something that we stressed extensively with our federal government partners. So again, I think, there are real concerns that even if we were to make the program as affordable as possible, there would still be barriers to accessing it, particularly around concern about public charge and some federal changes to the public charge rules that sort of further eroded community-based trust. So we know this is the environment we're walking into. We know that distrust of the healthcare system and sharing information with government, including the exchange, is something we need to be very mindful of. And again, it's something that we're sort of hoping to take head on. The next slide shows you a little bit about how over the past year we've been trying to prepare and address some of those concerns. So the first primary way that we addressed it was as part of our negotiations around the 1332 waiver. We sort of got some strong first-in-kind privacy language included in our waiver documents that other states are now sort of looking at and looking to mimic. We also got approval to update and change some of our CMS and IRS reporting requirements to exclude identifying information for people. We've instituted a new immigrant health coverage data policy to further protect data that's stored behind our system. We also looked really carefully at information that's being shared and not shared with federal partners, and updated our processes to minimize the amount of data that's shared. So we'll focus on this quite a bit, but if you are someone who is using Health Plan Finder who does not provide an SSN, who is not a citizen or not lawfully present, there is no personally identifying information that is sent from Washington Health Plan Finder to our federal partners. We will say that until we can say it no more. It's sort of important for us that community understand that we've done everything we can to sort of maximize the degree to which we're keeping people's information confidential and safe. We also will be seeking to spread that message, obviously, through trusted community partners. And so it's something you'll be hearing us focus on over the next couple months. We also met with our state agency partners, the Department of Licensing and DSHS and Department of Revenue and the governor's office, and people who have learned from the COVID implementation, people who've been working to sort of spread word in community and make sure people get the services that they need and are entitled to learn from them about how to update our practices and update our policies to be the most inclusive possible. And we'll talk a little bit more about that. So the next question just speaks at a high level to some of the protections that are in place on top of the additional protections that were sort of negotiated. The next slide, Caitlin, steps through sort of at a high level where there are protections that are existing and then were further strengthened. So everyone should know there is existing federal guidance that's been followed that we've received multiple assurances about. It's sort of summarized in this memorandum that we cited here, but it's also on the healthcare.gov website and something that's shared broadly, which is that information that's gathered through Washington Health Plan Finder or any state-based marketplace for purposes of applying for health coverage is not shared for immigration enforcement purposes. I think that's something that is unchanged, but important to emphasize given the upcoming expansions. We also have the explicit extra protections that are in our waiver that we feel good about, and that sort of said we're only providing aggregate data. We're not providing any individual identifying information or individual level information. As you all become interested in how we're doing and how our waiver's doing, we will keep it at an aggregate level. And that's sort of in the contractual documents we have with them. So feeling good about that protection. And finally, just sort of this extensive end-to-end review of our system and established additional protections for our immigrant health coverage program data that we're feeling like have further kept it, will further keep it secure from sort of internal and external inquiries. So that's some of what we've been doing. We'll go through a few common questions that we get. And then we'll invite Joanna and others who may be getting questions or have questions on identity proofing or privacy security to chime in. So the first questions on the next slide, we are often asked, will people still be asked for their social security number? Why are you asking for this information? How is it going to be used? How does this all work? So yes, if applicants have a security number, we're required by federal regulations to ask for it. When we get someone's social security number, we use it to electronically verify identity and income and other information, which we're required to for sort of privacy security purposes. So I know there's sort of there were some questions, I think, around verification. And how that works. Part of what makes Washington Health Plan Finder able to verify eligibility for all these various federal and state programs in real time when someone applies for health insurance is the sort of electronic verification that happens behind the scenes between a bunch of different federal and state databases. Again, just sort of wanting to reiterate here that not having an SSN is not currently a barrier and will not be a barrier to applying to any of the programs or financial assistance we offer. And if you are unable to provide an SSN because you do not have one, due to not being a citizen or not being lawfully present, none of your personally identifying information is going to be sent to any of these federal electronic data sources. So you will still be asked if you have an SSN, we need you to provide it. An SSN and an ITIN are not interchangeable. So we always, that has not changed. And we just want to reiterate for those on the call, customers should not put their ITIN number in place of an SSN. SSNs are very specifically used for sort of verification identification purposes, and an ITIN will not work. So again, just reiterating why and how this information is used and why we're asking for it, used for eligibility purposes only. Again, we're sort of working on improving and updating our on-screen language so that we're more clear and as transparent as possible about why we ask for SSN and how it's used and not used and how we're keeping that information safe. The 2 million people who are using Health Plan Finder today, there are tens of thousands who do not have SSNs who are applying on behalf of family members or applying for Washington Apple Health programs they still may be eligible for. So again, we have a healthy mix of people today both with and without SSNs who are using our system. And we want to make sure for any new people without an SSN who'll be using our system that we're explaining sort of why and what we're asking for as clearly as possible. The next question we get a lot is around identity proofing. So we have a federally required process we need to do under the Affordable Care Act in order for someone to come in and complete an application online that we sort of call identity proofing. So the question we get is, with these expansions, will everyone without an SSN, everyone including people without an SSN, still be required to prove their identity when they're applying online? And the answer is yes. So what does this sort of look like and mean for people? When you come to Health Plan Finder, you create an online account and you are sort of need to prove you are who you say you are. One way that we do that is through using your SSN. So it's sort of to protect people's information and to protect anyone who's unauthorized from creating an account and applying for health coverage without someone knowing. So it's important from a privacy security perspective, particularly with the increase in sort of cyber no goodness that has been happening across our country. So, when you are individuals who are applying without an SSN, who are applying online or over the phone, will need to upload a document proving their identity. This is a one and done type of exercise. So you come to the exchange, you create an online account. If your identity can't be electronically verified, which it won't be for anyone without an SSN. SSN is the primary way that people are electronically verified. Then you will need to upload a document proving your identity. We have recently expanded the list of documents that can be used. It very closely aligns now with the Department of Licensing and what they've been doing around state identification cards. There are two key ways that you could, if you were someone who is not comfortable uploading a document to get identity proved. The first is to apply in person with an assister. So a navigator, a broker, a tribal assister, everyone on the map that I showed you earlier, that you can meet with them in person. They can verify you without uploading documents, and you can move forward with the application and enrollment process. So that's an important piece of information for people on this call to know and share, and we hope you will. The other way that to sort of not, if you are not applying online and you are submitting a paper application, we are not required to sort of electronically verify you in the same way as we are if you were applying online. So two good options there. I'm going to take us through the documents list and just put those on screen while we're sort of pausing to see, Caitlin, if there are other questions, or Joanna, if there are other points of emphasis you'd like to include. So again, there is an extensive list of documents that are available that someone can use to prove their identity in a way that would then allow them to apply for health insurance, voter registration cards, passports, sort of IDs, school IDs, and so on, any kind of permanent resident card, anything from a tribe. And then you can see the newly added materials on the right, again, with the intent that any document that you would have as part of the immigration process could essentially be used. The next list of documents, if you are unable to provide one from the first list, you can use a combination of things. And again, we will make this information available so that people can know what they need. We'll do extensive training with our assister network on this information. So this will be available. People at our call center and people across the state in our assister network will be able to help anyone provide a document that allows you to continue to submit an application. I'll pause there, Joanna and Caitlin, and see if there's anything else we should address specifically on the issue of identity proofing before we sort of round out this privacy security section. If we need to, Caitlin, I can do the next two questions too. We sort of preloaded some questions in the webinar. So I'll come back. If you do the next slide, let's finish it out and then we'll take a pause here and see where we are.
Sounds great.
The question that we get often is, if you don't have an SSN, will any information be shared? Again, we'll say it until I can say it no longer. No. Again, if you're unable to provide an SSN, you're not a citizen, you're not lawfully present. We're not sharing your personally identifying information with the feds. The next slide speaks specifically to the public charge concern. So again, will applying for health insurance through Washington Health Plan Finder make someone a public charge? No. Applying for receiving Medicaid or CHIP or health coverage through a qualified health plan or dental plan or federal or state subsidies doesn't make someone a public charge. It doesn't affect your chances of becoming a lawful permanent resident or a U.S. citizen. Okay, the next slide just is, again, our pause. Lots of information there on government mistrust, privacy, security, how we use your information. You know, I'll say that the typical processes we use today around, you know, verifying your income and, you know, working with people who file taxes on their tax information, combining health insurance and taxes was a really interesting thing the Affordable Care Act did. Processes around income verification and tax filing are unchanged. So again, for anyone who has sort of interacted with our system or is familiar with how we do that today, we haven't included information there just because it's unchanged from how we do it today. And I'll sort of pause. That's typically questions we get are around tax filing and income verification as well. Not included here today because nothing notable changing there, with the exception of working with CMS on the 1095 so that no identifying information is being shared. All right, Caitlin, Joanna, we'll pause there to see if any other points of emphasis or things that you should want to highlight based on the questions we're getting.
We do have quite a few questions around income verification and tax filing, which you addressed. I'll also just mention that we will be sending out, you know, the FAQs from this webinar in addition to the recording and the slides. So we'll be sure that if your questions were not answered today, that we will address them. We are getting a couple questions around birth certificates being translated and a request to go back to that list A. So I'm going to do that now. Joanna, not sure if you want to address translated birth certificates. That might be something we need to follow up separately on.
Yeah, I think, Caitlin, that is something we'll need to follow up separately on.
Okay, thanks, Joanna.
And I'll also say to folks, as we're looking at this list, you know, given we have 400 of you on the line, you know, if there was a document that you would have expected to see here that you're not seeing, our goal was to make this as inclusive and expansive as possible in conversation with our agency partners and federal partners. So to the extent that there is a document that you have used or use in other programs or would want us to continue to look at, definitely let us know if you are seeing something that's not represented in this list that you think should be. Our intent is for this list to be as expansive as possible.
Great. And again, I'll just I'll share again that the slides and the recording will be published on our website. So these lists will be available online.
Great. Thanks everyone for the questions. We're an hour in, we're on the home stretch here. The next section will sort of speak through, talk through some of how we're hoping to spread the word with our upcoming outreach and engagement campaign to really address barriers related to health literacy and language access. And we'll invite Wynn and other staff and Becky and others on the call who have additional points of emphasis here to, of course, jump in and help me. The exchange is working with the VITA agency, which is a marketing firm that is sort of steeped in community outreach and engagement around the new coverage programs. are sort of working with them in based on the feedback that we gathered from the interviews and the listening sessions and the landscape scans to create sort of new materials specifically to support these immigrant health expansion launches. We've committed as an organization to translating these materials and to really developing a new content that's responsive to what we heard, particularly around addressing privacy security concerns and others. So the next slide shows you a bit of what the materials will be emphasizing and provide some example of early look and feel. Again, you'll be receiving all of these from us shortly that we are hoping you can provide feedback to us as we learn as we go here with these expansions, and also distribute broadly to your networks and otherwise. So we're really focusing on from a health literacy component on just sort of what is in health insurance and how to access it, and most notably where you can find enrollment assistance in your area and in your own language. We have an ability to search. You can search for an assister online who speaks your preferred language. It's an important feature that we'll be sort of making sure to reiterate as we know people will be looking for in-person help. We're working on translating materials. We'll translate them into as many languages as we're able. We're starting with Russian, Spanish, Vietnamese, Chinese. Again, we're looking at and we're focusing on multiple mediums and formats. So, you know, we're doing a collaboration with Urban Artworks, which is really exciting. So this fall, there'll be some art projects going up around the state. And again, people have sort of proposed projects in multiple languages and sort of different formats that we're excited about, and you'll be hearing more from us on soon. The next slide shows you some of the sample digital and print materials we'll be working with. Again, emphasis on, you know, new eligibility, key terms, costs, security, how information is and is not used, and how to connect with someone locally in your area. Those are all main themes of the materials that are being finalized and getting ready for distribution. We did also really want to flag an opportunity for community-based organizations to get involved and to help us spread the word and do some outreach leading up to the launch. The next slide speaks to the community-based grants that we're offering to community organizations to help us do outreach to impacted populations. So again, we're making $100,000 in sort of micro grants available. We have an application that's open until September 13th. So if you or your organization knows of someone who can help us spread the word to diverse immigrant communities across the state, we'd love to hear from you. You can see to the right the timeline that we're working with here. Toward the end of the month, we're going to be making our final funding decisions, distributing funds in October, and then from October through open enrollment, focused on engaging with the grantees to help support them with materials and information as best we're able, in partnership, obviously, with our assister networks and our brokers and our navigators and our travel assisters. And our lead organization networks, sort of working in partnership to sort of blanket as much of the state as we can. There will be a sort of report back requirement that would come following open enrollment that we're looking to sort of make as simple and streamlined as possible. That still gives us a sense of reach and sort of communities reached and impact. I'll pause there and see if there's any other points of emphasis around our upcoming outreach and community engagement.
Yeah, we're getting a couple of questions around who to contact if folks would, one, like to receive these outreach materials, or if they would like the materials in additional languages beyond those listed. So I'm going to drop the email address for Jenny Arredondo into the chat box. That is the best person here at the Exchange to reach out to. These materials will be available towards the middle end of September. And so once we have the final versions, we'll be blasting them out. And so we'll get you added to our list to receive them, and they will be available on our website, wabiexchange.org.
Thanks, Wynn. Appreciate it. Caitlin, others, any other outreach related questions? we should address. I would highly encourage anyone who is interested in, even has a remote amount of interest in potentially receiving one of these outreach stipends, to visit the website that's on screen now and learn more information about sort of the types of projects and that we're looking for. I think we have a broad definition of community-based organization. If you are someone who reaches undocumented immigrant communities, we want to hear from you. If you have a creative way that you think you could reach them, that would help make people aware of these new coverage opportunities, that's exactly the type of project we're looking for. Caitlin, we can jump to the next slide and then tee up our final and last next steps section. Thanks again for the engagement. Really, it's heartening to see so many people on the call, especially on a holiday week. Really impressive work that's happening in the community, and really appreciate it. Okay, last sort of content slide from us before we then just sort of step through some resource slides and then invite any final questions and sort of wrap up here. Here in a nutshell is where we're going in terms of the next several months. So, you know, we're finalizing our materials this month. We're starting our sort of training and outreach in earnest next month, leading up to the QHP and the QDP expansion launch on November 1st. Then we are in open enrollment. We're in open enrollment from November 1st through January 15th. That is the time that most people will be able to access a qualified health plan and qualified dental plan for 2024. If you miss that window and you are someone who is up to 250% of the federal poverty level, or you are someone who will qualify for a Medicaid or Washington Apple Health program, you can apply after the 15th and still get coverage. We encourage as many people as we can to check their eligibility during that window, just in case. Following open enrollment, we're going to be looking at the data and the lessons learned from community and you know, sort of learning from feedback from our outreach partners and our grant recipients and our on-the-ground network who are going to be helping us during open enrollment, to then gear up for the Washington Apple Health expansion launch. Again, we will sort of be leaning into that as we approach July 1st, when that new program will become available. And then because the Washington Apple Health expansion, you know, enrollment is ongoing into Apple Health programs, so we'll be doing outreach and communicating as needed based on whether or not enrollment in that program, you know, when and at what level it needs to be capped. So that's our lineup. Becky, I'll also pause there to see if there's anything else from a healthcare authority or Apple Health perspective you would want to add, but we have quite an aggressive lineup heading into this open enrollment on top of what is our typical and usual open enrollment activities. So you'll be hearing from us quite often as we move through these next few months. But Becky, we'll pause there and see if anything from a healthcare authority perspective.
Thanks, Joan. Yeah, no, I think you covered that well. Really, lots of emphasis right now on open enrollment, and then we will be shifting after the first of the year. You'll start to see increased volume of activity from healthcare authority around the Washington Apple Health expansion program. So really appreciate the interest and the engagement in today's webinar. I think you can expect to see similar activities here as we move forward in the new year. So thank you, Joan.
Thanks, Becky. Really appreciate the partnership. Thank you so much for being here.
Of course.
Okay, so we'll maybe come back to this slide as we're taking final questions, Caitlin, but let's just quickly reference the resource materials so everyone is aware of what resources we're making available, and then we'll come back and wrap up. Here are the links that we're making available. They were top of mind as we were pulling together the webinar and thinking through what people might need. So there's more information, and this webinar slide and links will be posted on our 1332 waiver information website. That's where you'll be able to access, you can see the materials related to the waiver of interest, and also access more information on the qualified health plan and qualified dental plan expansion. We're working on building out some immigrant health coverage web pages on our corporate site as well. So those I would put in the coming soon department. In terms of the Washington Apple Health expansion, you can see the link provided there by our colleagues over at HCA. The map that provides sort of direct contact information for navigator lead organizations and enrollment centers, which are sort of the entities in your area that can help provide enrollment assistance and can help staff enrollment events and speak to people in your organization or your community about Health Plan Finder and the health coverage programs that are available through Health Plan Finder. That's available, and you can also contact Kelly. We provided her contact information earlier. If you are a community-based organization interested in connecting with and becoming part of or further leveraging our Assister network. And finally, just more information on the outreach opportunity, funding opportunity we just mentioned. The link is provided there for anybody representing an organization on this call who may be interested in helping us spread the word. The other slides that are included in the deck for in case they're of general interest, one, here's sort of our snapshot of the different types of assistance we have available across the state. And again, where on Washington Health Plan Finder you can search for a navigator or broker in your community. You can search for preferred language spoken. We also mentioned previously, but are repeating here, information for our customer support center. And again, sort of our customer support center hours we shared previously, but for anyone who would want to download the app, we encourage you to do that. For anyone who wants to contact us or has specific questions for our call center, we encourage you to sort of connect with us during open enrollment or connect with an assister during open enrollment and let us help you. We can chat with you online. Happy to answer questions and address questions as much as you're able. And then the next slide, for anyone who wants to follow what we're doing on all the social medias, we push a lot of information and we'll be pushing information about the launch and information about our new digital and print materials through Facebook and Instagram and Twitter and all the things. You can also kind of sign up for email updates from us. All ways that you can sort of get yourself connected to some of the different information channels related to the expansion. And that sort of concludes our content portion. Caitlin, we can go back to the timeline there, the milestones timeline, and address any final points of emphasis or questions people may have.
One moment, Joan. It looks like I've lost the slide deck.
It's all right. Everyone will be able to access it shortly.
I do have just a couple questions in the Q&A if you want to cover just more general questions.
Yeah, let's do it.
So does the QHP expansion, is that available to clients over age 65?
It is. Becky, I think you may be the best position to answer this one. But yes, sort of regardless of age, you're able to come through Washington Health Plan Finder and see what program you're accessible for. And then you're also able, for people who are dually eligible for both Medicaid and Medicare, there's an avenue for getting connected to the program through Washington Connection as well. But Becky, we'll make sure you keep me honest there in terms of the Apple Health expansion being available to folks who are over 65.
No, Joan, great. Thank you. Appreciate that. Good question. Yes, the Apple Health expansion is available to clients over the age of 65. It is a 19 plus program. So just 19 years and older.
Thanks, Becky, so much. Wynn, Joanna, Caitlin, let's do some final wrap-up questions and get folks out here on time. Anything else, Caitlin and others, we should sort of generally address?
Sorry about that. I was muted talking away. It looks like we may have had a glitch in the recording that we need to investigate. Should there not be a recording for any reason, we do have the slides as well as all of the questions. About 150 questions were submitted today during the webinar. And we will work to get all of those answered. If they were not answered today, we will send out an FAQ covering all of those questions. And I think that is in terms of next steps. We've put in the chat in the Q&A box, the web page where to find that information. It will be posted soon. I cannot commit to a day. I know there was a question if we can get the slides today, but as soon as we can get the materials out, we will do so.
Thanks so much. Thanks to everyone for your questions and your participation. I think as promised at the beginning of the webinar, if folks found this useful and informative, please let us know. If you didn't, please let us know. If there is interest in us sort of doing a refresher webinar or a second webinar as we get closer to the November 1st launch, if that would be of interest and something people would like to see from us. Again, happy to hear that feedback and bring that back internally as well. So really appreciate everybody joining, and I think we'll wrap it for today. But again, thanks so much, and more to come. Thanks all.